Hi, this is Linda Larson Schlitz, and I am really excited to get going on changing the world with your help. And we're going to start this month, right now, today, going to start with dealing with alcohol and substance abuse issues and mental illness and how it affects our society, how they all work together, and what can we do about it. Now, I know there's not anybody watching this that has not been affected by someone with a substance abuse problem or a mental illness. The majority of us have had some of these within our lives. Studies show at one point that 43% of people in the workplace have a mental illness or a substance abuse disorder in any given year. If that's the statistic, oh my gosh, that's a lot of people that are dealing with this. And it is such a pervasive problem. It affects so many different things in our lives that where do you begin to change the status quo? I had a supervisor who once called me a paradigm pioneer, unafraid to challenge the status quo. And it's true. Unfortunately, I can't do it all alone. And I also sometimes ruffle feathers because I get frustrated when the system doesn't change and people are not getting the care that they need and the support that they need. So I need help. I need help to start to make these changes. Now I know that the majority of you out there, especially if you're in the field of counseling, social work, human services, legislation, we're all trying to do something to change the system. But I think probably the majority of us, just based on how many people vote or not, we are at a sense of learned helplessness. Like there's, what can we do? What can we do? You know, it's out of my hands. It's up to the government. It's up to the legislator. And then we sit home and we complain about all of the people out there doing all of these things or not doing all the things that we think they should be doing, and we become a part of the problem instead of a part of the solution. I have always tried to change that status quo. I don't like status quo, especially if it's not working. And we all know that the system is not working. Our healthcare system is not working. I actually have 12 top things that are on my list of things that need to change if we are going to make an impact on the number of deaths that we have, the kids that die from substance abuse and alcoholism. It's like the third leading cause of death. It's crazy that that's happening. Drunk driving, unbelievable amounts of money it costs to deal with drunk driving, but also the deaths and the injuries and the medical costs. So let me start with, what do we need to change to begin with? Number one, we have to change our norms. We have a norm in our society in the United States, especially in Wisconsin, of drinking. Drinking is a norm. It is a norm. Cheeseheads, what do? You drink free beer and you eat brats and you do all of those things. Think about the norms that we have. How many nonprofit organizations out there are doing fundraisers by giving away free beer, or as part of their ticket they get to drink? And it's surrounded around drinking. Wine and cheese is one of the ones we have around here. We have polka festivals that are fundraisers, but it's all about drinking. We have Chamber of Commerce meetings that they have a get-together, 5 o'clock get-together in the evenings once a month, and it's a good time of networking. But it's drinking, lots of free drinking. For $5 you can get really drunk. How many of these events, how many businesses plan events around or in the bars? How many employers actually even pick up a case of beer? I know a lot of times if you've had a hard day at work, maybe building, I've seen this a lot with people who are in construction. You know, bring a case of beer for the guys after a hard day. That's our norm. And when that becomes our norm, it's a norm for everybody. Then when you use alcohol or drugs to self-medicate, whether it's to celebrate or you had a bad day, let's go have a few, or let's smoke a joint, or let's pop a couple pills, that becomes what our children see. And so our children are growing up with a norm that drinking is good, it's acceptable, it's the way that you cope. And drugs are the same, whether it's taking that pill, whether it's smoking that joint. Now that marijuana has been legalized, it becomes a coping mechanism. Now, is this the best choice, or wouldn't it be better for us to teach people how to communicate, how to deal with their feelings, how to find healthy ways of doing it, like exercise? So our norms are like the first thing, I think, that needs to change. Secondly, we need to look at getting people the help they need to have a purpose in life. Without purpose and meaning, people don't have a real reason to get up in the morning and go to work and enjoy themselves if they have not found that they're doing what they're gifted to do, what they're created to do. I believe that's what I call faucet of hope. We are all meant to be doing things that benefit other people. We're on this earth to bring our gift that we've been given to the people who need it the most. And as faucets, we have lots of good things to give out. And for me, it's a spiritual thing. And God is trying to reach out to change the world and to help people and to bring them to that knowledge that they've got a good life, that life can be good, and that He's got a plan and a purpose, and there can be meaning and hope, and they can have a positive experience and leave a legacy that will be positive no matter what their legacy is now. If you've been in jail, if you've raped, killed, and stolen from people, that's not a good legacy. Can you wipe that out? Not entirely, no. But you can change and make a positive thing out of a negative. So you've got to look at finding purpose and meaning, helping people realize, discovering their gifts and what it is, and valuing them. That's another thing. We don't value people. We don't value who they are. If they've made mistakes, if they don't have it all upstairs, if they have a problem like I do, attention deficit or bipolar or whatever it might be, then we call them names. Ditzy blonde, airhead, space cadet, dumber than a brick, retard. I mean, those titles still go around, and it hurts. And people don't feel they're as good as the next person. That's not true. That is not true. So that's the next thing that needs to change, is that we've got to find a sense of value and purpose and hope for people. Next, we need to be looking at how to give people the help they need if they do have a problem. How to get the treatments. It's a huge problem with substance abuse and mental illness. There's no treatment. Now, why is it that we are criminalizing behaviors like somebody running naked in the street, okay? Because he hasn't taken his meds. He's in a manic episode. He's schizophrenic, whatever it might be. They're doing crazy things like that. And what do? We charge them with indecent exposure, throw them in jail, and they still don't have the treatment they need. Or maybe we'll let them out, go to the healthcare center and get some pills, and then we send them home with no supervision. Or maybe we send them to the shelter home, Salvation Army, because they don't have a place to live because they are not well. It's really insane. It's really crazy. So that's another thing we need to do. We need to be looking at how can we collaborate. We don't collaborate well. How can we work together, get off our turf issues, get off of the things that, it's all about me and my idea. And I'm at fault at times of this. But that's because I'm frustrated because we aren't working together. We duplicate services so much. It takes an unbelievable amount of money to duplicate services. We have a case manager for every single program. Why don't we figure out how to have a case manager for each person that manages everything? Just one case manager that manages their food share and their medical care and their in-home care and their supportive housing and their supportive employment. One person that manages all that. And of course we'd have more case managers doing individual things. I mean, I've got this all ideas, and I know that there are a lot of you out there that have had the same ideas and ran into brick walls because we don't do it that way. We've got policies. Here's the next thing. Policies, procedures, gotta change. They gotta change. Just because we have a policy, a procedure, or a law or a statute doesn't mean it's a good idea. Who makes these ideas anyway? Think about it. No offense to you legislators out there, love ya, but you don't know what you're doing sometimes. If you haven't been in our shoes, working in the system, you don't know what it takes. You gotta listen to us, but it's not your fault because we don't tell you. We don't communicate with you. We don't let our legislators know. We don't even go vote. Look at the number of people, like 30% of people voted at our last thing in my area. That's terrible. That's terrible. And we used to put bondage on people so that they couldn't vote. You know, you couldn't vote if you have a felony, and you couldn't vote if you didn't have an ID. And now we've tried to clear some of that stuff up so people have opportunities. But we kind of almost had the people that needed to vote the most didn't have the opportunity to do that. So now we need to change that. And we need to speak more and get our legislators on the front lines of these kinds of discussions. We have to work on this together. And so my mission for the next 3 months, hardcore, is to get as many people nationwide as I can on board with making systems change. The systems need to change. Social services needs to change. The government needs to change. The businesses need to change. Families need to change. Churches need to change. Individuals need to change. We have to do this because it's killing us. It's killing us. And it's killing our children. It's costing us so much money and time and effort and billions of dollars in lost productivity every year because people are stuck with these issues. There are solutions, folks. There are solutions. The employment, a lot of people don't have jobs. They get fired because employers don't know how to deal with this. It's one of my areas of expertise, is going in and helping employers know how to make accommodations for people with mental health and substance abuse issues. There are ways to do it. And again, I go back to the problem. If you aren't doing what you love to do and you're created to do and you're good at doing, you're either going to quit, you're going to get fired, or you're going to get sick. So then we start the whole cycle over again, and people start drinking and using drugs to cope because they hate their jobs. It may not be that that's not the right business. It may be that you just have them in the wrong position. You just have them in the wrong unit. You just need to get them a helper to do some of the things that they need to do, like me. Organization, not my cup of tea, which is why it's taking me so long to get my business off the ground here and my coaching, because I can't pull it all together. It's hard with ADD. So there's the point of why collaboration is a must. None of us are created to do everything. None of us. And even though some of us tend to be bossy and bulls in china shops, which is what one of my bosses called me as he exited me. He gave me an 8-week notice. That was cool. But we're pushy, but we need to learn how to bring in those other people to help. And that's what we need to do with this. We have to get everybody on board. We have to get the people that are in the front lines, that are living it day in and day out, that are in the system and are being violated by the system or not treated. People don't know. Yes, we do studies. The most recent study by the organization that does studies is 2010. We are almost at the end of 2015. That's not acceptable for us to not know how these systems are working. So we got to find better ways of evaluating whether the systems are working that we have. And I can guarantee you they are not. They are not working. So anybody you ask in the system will tell you that as well. So we've got to work on those things as well. We've got to work with educators. Educators need to be able to teach some of these things. I was a school counselor. We didn't teach kids. That was the whole deal about the school guidance counseling program, is developmental guidance model, which helps people at every stage as they're growing learn new things that are relevant. But even that is mandated, what we need to teach them. And in that whole thing, helping students learn how to communicate on a real level is not, there's not enough of that. Why? Because our teachers don't know how to communicate. Our teachers are still stuck in the old punishment is better, shame works better. No, it doesn't. Shame does not work better. We need positive. So that needs to change, that piece of this whole thing. The family systems. What family? What is a family? Well, for a lot of people, a family is the people who love and care about you. And that's not necessarily your blood relatives, because a lot of people, especially if their mental illness or substance abuse issues have caused problems, yeah, that may be the last people that you call family. So we've got to work on those family systems, whatever they are. We have got to find ways to work within them and help to empower them to get involved in this, find new ways of coping, and give them the support they need to do that. We've got to work on the government priorities. Okay, I say we, because we still are the people. Are we not the people? We are the people. And we are the ones that have to make the changes and have to get our law, legal people and our government to listen to what needs to change, because we still are a republic. I know we're losing a lot of ground here, but why is that? Who's yelling the loudest? It's not the people that founded this country and the principles that it was founded on. We're not yelling loud enough, so we need to be doing a lot more of that. We've got to look at issues like housing. Where are people living? If they aren't employed because they've got problems or they just lost their job and then they don't have a housing, what are they supposed to do? And then they owe child support because they lost their job. And what do? At least in Wisconsin, one of the first things after sending them a letter of threatening to take their driver's license, we take their driver's license. Does that make sense to anybody? That we take their driver's license? Can't we figure out, put them on probation, fine, and have somebody monitor them, or hire them, or require them to go to the job center and work with a guidance or a counselor like I was. But take their driver's license? I can't tell you how many people lost their jobs after they got them so that they could pay child support, and then lost them because they didn't have a driver's license. You can't work construction if you don't have a driver's license. Nearly impossible, especially if you own your own business. So that's another one of those. Who came up with this idea? Not probably somebody who works in the employment field. Another thing we need to work on. Things like drunk driving. Oh my gosh, the laws are just insane. They're crazy. What inspired me to take off and do this was Jason Breitenfeld, who got hit by a drunk driver 2 years ago. And when his perpetrator, who was his fourth drunk driving, second time injuring people, didn't have license or all of these things in the car, driving too fast for conditions like 70 miles an hour, crossed the center line, and got to get out and get his driver's license immediately without practicing how to stay clean and sober. Okay, what's wrong with that picture? Systems broken. Funding. Where's the funding going to? Who are we funding? We are not funding the people that need it the most in our country. We're building more prisons and shutting our treatment centers. What? What? I'm dumbfounded. Good news for all of you counselors and social workers and professional people. The majority of everything I'm going to be doing will be valuable for continuing education units. I've already checked this out. I've already taught a lot of these. I've already gotten approval for the majority of the kinds of things that I'm going to be teaching, and I'll be sure to give you things to evaluate you so that you'll be sure to be able to get credit for the things that we're going to be teaching. So please, if you're interested in being involved, you want to teach one of these classes, you want to share your expertise to get your word out there, please let me know. I'm really looking at people that are leaders in the industry, and I need more of them. So please, if you're one of them listening, I don't care where you're from, I don't care if you're from somewhere else, because somewhere else has a better plan. Other countries are models for us, and we need to be open to that. I thank you for listening. If you got to the end of this, thank you. And then the next video, we're going to talk about the nuts and bolts about how to start making this thing happen. We need to make it happen. So we'll be going through that. And again, that too will be a training for you. And there will be another freebie that you'll get on that. So please tune in. There's going to be 4 of them here we're going to do, and I hope you'll stick with me. Thanks. This is Linda Larson Schlitz from the Faucet of Hope.